Welcome to today's presentation. My name is Dr. Dickens Lubanga. I'm a pediatrician based at Bungoma Children's Hospital. Today we are going to look at teething and care of teeth in children, especially. And this is a very important topic because usually in my areas of practice, I find parents usually have one or two or three questions about teething in their young children. And remember, majority of it, some of them are myths, some of them are questions that will actually require attention. So today we are going to look at those questions in detail and see the ones that you're able to give clarification in terms of answers on how best you can be able to help our children develop a good teeth, develop a good dental formula, and also not have issues, especially with their teeth. So normally, teeth development begins even before birth of a child. So you find that even by the time the child is born, they have some bumps on their gums. So one of the things most mothers usually come up and say and ask about is about um, false teeth, false teeth in children. So some mothers are really worried when they see those bumps in the gums of the teeth. They keep on asking, are these teeth or they're not teeth? Usually, most of the time, I've had to reassure them that those are just normal bumps that are later going to pave way for the developing teeth. And remember, in terms of teeth for the children, usually they've got two sets of teeth. This the temporary teeth that are wrapped at birth, and they're just to guide the new permanent set of teeth that will come to develop around 6 years of age. But initially, when they are born, they get those temporary teeth whose main function is just to hold place for the permanent teeth as they come up. So when babies are small, usually you might not necessarily have to brush their teeth, but we normally encourage the mothers to just take a clean finger and try to wipe the gums at least twice in a day to just ensure that the hygiene of the child is okay. Now, what can help to disrupt the teeth or the formula of the teeth during this period? One is those mothers who like feeding small babies using bottles, especially at night. So you find the child is always having a bottle and with milk the whole night. So usually milk has got some other things like sugar in it. So you'll find that it tends to, and the bottle itself tends to affect the dental formula of the teeth. So that now these are people, once they grow up, they're around probably 10 years, they'll want to use other means to straighten the teeth. Uh, you've seen people trying to put some dentures either in their teeth, either primarily to align the teeth. But actually, some of these things they can be taken care of by you avoiding uh, putting the child's or allowing the child to sleep with the bottle while feeding, because you are feeling that this child is going to disturb you. Remember, you'll achieve uh, you'll achieve the benefit of them not disturbing you, but eventually it's going to affect how their dental formula is going to be, and you'll have to spend a lot of money. And remember, some of those costs that are involved in aligning of these teeth, they can even go as high as 100,000 shillings or even more. And so you are saying that it's better you allow these children to have their natural sets of teeth. Let us try to wash them as adequately as possible. That these that those in terms of hygiene, that those toothpaste that are for child friendly. So you can actually use those toothpastes, and when they're brushing, you try to you try to be there and show them how to brush, because a good brushing for children, especially those ones who already have teeth, I think they should be able to brush for around 3 minutes at each episode of brushing to ensure that they clean and to remove all the plague that is buried inside the teeth. And even for adults, we say that when you're brushing your teeth, at least brush for around 3 minutes. Now, an important point here. So you're saying that at least by the time the child is hitting 7 years, which is called the rule of seven, at least they need to have seen a dentist, because that's when now the permanent set of teeth have started erupting. They're starting to have the incisors, and usually the molars have started erupting at that period. So they require a dentist to check whether the denture is okay or it has some kind of issues. So I also want at this juncture also to clarify one or two things. When children are young, majority of parents think that when a child is erupting teeth, then they'll tend to get diarrhea and they tend to get fevers. You are saying that the main reason, that is not the main reason why they're getting that. Remember also for children in terms of their development, they have an oral stage. Oral stage means that they tend to put almost everything in their mouth. So even their fingers, they tend to put in their mouths, they tend to put it. They have a remote control on the table, they tend to put. You give them anything, the first place, the place is their mouth. So ideally, most of those things might have a bit of bacteria, they might have some viruses, because so many people are touching them. So when they put them in the mouth, probably they can get an infection, probably a diarrhea, but it's because of the dirt or because of the contamination, probably they will have suffered um, from the objects they're touching. Sometimes they touch shoes, put them in their mouth. So ideally, teething itself by itself does not cause diarrhea. And remember, when children are teething, they might be uncomfortable because of the new teeth. So they might want even to bite you. They might need some. Uh, they might need some objects or even some clothing that help them in terms of when they put in the mouth, they tend to soothe, they stimulate it, so that you don't have to put other things in the mouth. Remember, this is a normal process and it's a normal physiological process that happens in everyone. And it even happens in animals. And we normally say that the first teeth, try to extract by yourself. Because those are teeth, even dogs extract their own teeth. So, but you have seen also a trend whereby even mothers, even the first teeth, they want to be extracted in the hospital. Yeah, this is a temporary set of teeth that these children you can even extract it right at home. Yeah, but you find that sometimes we are so it's like we don't want these children of us to feel any pain. But remember, that's a natural process. It should not be something that we are trying. Oh, this is. Let us try to allow natural process to take place. Not everything requires you to go to a hospital. But again, if there are issues in terms of the teeth, then we always say that the child requires to see a dentist. I'm saying this because I've seen some cases whereby those primary teeth are extracted wrongly. So you find that they lose the nerve that is there. So it means that this child will not develop any teeth later on. So we say that some of these things, unless if completely it's not possible or the teeth has overgrown itself, because sometimes you can meet some tooth that tends to overgrow. But the reason why they overgrow is because, again, you allow this child maybe not to extract the teeth. At some point, it was loose enough for you to remove it, but you let another teeth to come up in the same gum. So it becomes difficult for you to remove the initial teeth. Now, that's cases that now they'll force you again to go to a dentist for extraction of this other second teeth that is growing. But what you're saying that when you see the teeth has given you the first symptoms, extract it, remove it. It can be removed at home and it's just a slight pain. If you know how to do it very fast, because we normally do it very fast, and usually the child might not even understand what's happening. Previously, when we were young, we used even to tie a thread and you ask the child, you tie it somewhere and you tell the child to run fast, and it will just pull itself off before even the child realizes and the teeth is out. So you can use other ways of removing it by trying to ensure that the child might even find it playful, uh, depending on how inventive you are in terms of how to remove those teeth. But ideally, in children, if well taken care of, then you find that they did not have a lot of issues. Now, another option I was talking about is about diets. We tend to say that let us try to avoid sweet foods, because sweet foods tend to form a lot of that plaque, and usually plaque will cause will cause will cause cavities in the teeth, and these cavities sometimes may require filling of the teeth, which are again processes that cause other issues. Remember, anytime you visit a dentist, also You might live with other things, like in terms of sensitivity of the teeth. So you find that your tooth suddenly becomes sensitive. You're taking cold things and you can't even take anything cold. You can't take anything hot because the teeth become sensitive. So you're saying that let us take care of our teeth, because if you take our teeth very well, then we just go to the dentist for reassurance. But ideally, we are doing the right things. And if these teeth are taken care of very well, you find it is easier for all of us. Yeah, I tell people that at my age right now, I never visit a dentist, and yet I have teeth. I've never had any issue with my teeth, which I thank God for it. But if you take good care of your own teeth, then you should not ideally be having issues with your teeth. And this is very simple. Don't take sweet things. Remember, the glucose, the bacteria in the mouth use it, and they give you also bad smell in your mouth, and also they make plagues to develop earlier or faster in people who are not cleaning these teeth very well. If you're the kind, again, brush your teeth at least 3 times in a day, if possible. But to encourage, at least you need to brush your teeth at least 2 times in a day if you're able to. That way, you're able to take care of your teeth in a way that they'll be able to serve you longer, because you don't know how many years that God has given you or even your child to stay on this earth. You might need those teeth for even a longer period. Thank you.